Welcome to Crack the PANRE-LA Code webinar. So today we're going to discuss all things about the PANRE-LA, the specifics of the exam, including how it's structured, how the scheduling works, the scoring works, and some strategies for taking the exam. We're also going to discuss some tips and tricks for multiple choice items because everyone gets rusty between certification cycles about how to actually take the exam. And then we're going to show you around our AAPA PANRE-LA reference guide so you can know how to get the most of it during the test. And we'll talk about subscriptions and all the details. We're going to get everything taken care of in this hour. My name is Katie Iverson. We're so glad you're here, whether you're listening live or the recording after the fact. I'm a PA. I work here at Hippo Education, and I'm joined today by Chelsea Meacham, who is my PA partner in crime here at Hippo. We hope this webinar will help answer your questions and help ease your anxiety about thinking about signing up and taking your PANRE-LA. And the one last thing before we dive in, we will have some time at the end for question and answer. So please put any questions you have in the chat and we'll get to them when we get finished.
Let me introduce myself. My name is Chelsea Meacham, and I have been a PA for 13 years. My main clinical background is in women's health, and I work part-time for Hippo Education as a senior medical editor. I work mostly on our PA products, including the PANRE-LA reference guide, which we will discuss more later. And I just finished my third quarter of the PANRE-LA.
I spent most of my 20 years of clinical work in the emergency department. And for the last 15 years or so, I've been in education part-time on faculty at the University of Iowa at their PA program. And for the last 8 years, I've been here at Hippo. I'm a senior director of education here. And along with Chelsea, we oversee all the PA products. I finished my PANRE-LA this past December. And a fun fact, I was Chelsea's faculty advisor when she went to PA school. So we've been a duo for quite a while. Okay, so let me take a quick moment and just go over what the PANRE-LA is and the exam choice and kind of what it entails and about your registration window. So because the PA certification has changed from 6 to 10 years, which happened a few years ago, some of you that are up for recertification 2029 and available to register for the PANRE-LA right now, you may have taken the pilot that was offered before, like in 2019, 2020 timeframe. So you may have some familiarity with like the at-home exam from NCCPA. So this exam is similar, but it's not exactly the same. It's taken over 12 quarters or 3 years, and you have to pass 8 of the 12 quarters. So if you take all 8 in a row, it's possible to get done in 2 years. However, if you take a break because you have a busy quarter with life stuff that comes up, or you forget to take your questions one quarter, you have 4 extra built-in quarters to get your 8 done. And then even though we take the PANRE-LA earlier than our certification cycle, so we take it like in year 7 and 8, that 10th year of our certification does not change. So I'm due for recertification in 2026. I finished my PANRE-LA in 2024, but my 2026 doesn't change. It's not like it goes earlier because I got done early. So I'm technically not due again until 2036. So there's a lot of years to think about here that we're throwing out, but always use the NCCPA dashboard just to see like what year you need to recertify in and then what years you're available to take the PANRE-LA, or if you decide to take the traditional PANRE, like in a testing center. So for many of you watching, as I said, this is year 6 for you. So you should be getting emails from NCCPA about saying it's time to sign up for the PANRE-LA, it's time to sign up for the PANRE-LA. And if you recertify in 2029 and you're listening and you can hear the sound of my voice and you have not gotten an email from NCCPA about signing up, you need to pause because go to the site. They have your wrong email address. Okay, just kidding. Don't pause us, but do it right after. You have to have been gotten a bunch of emails already from them saying it's time to sign up. So if you haven't and you think you're due in 2029, I would check your email to make sure. So our esteemed VP of Education here at Hippo that Chelsea and I work for is a PA, and she recertifies in 2029. And yesterday she sent me a message and said, I've been ignoring my emails from NCCPA. Did I miss a deadline to sign up? And I was like, come on, Vicky, get it together and come to the webinar and we will tell you all about it tomorrow. So everyone wave to Vicky who's watching. I made her watch so she could learn about when to sign up. But the deadline is December 18th. So they open it in July, which is when the emails start coming. You will get reminder emails all the way till December saying it's almost time, deadline's closing, deadline's closing. And then if you miss that deadline on December 18th, you miss it. And there's no way to sign up for the PANRE-LA after that. You will have to take the traditional PANRE in the testing center. That decision has been made for you if you forget to sign up. But if you get confused about any of this, look at the dashboard dates on NCCPA because it will help you figure it out.
Totally. So The questions will begin in January of your year 7. So for those of you who are just signing up now this summer through December, to take it, your first batch of questions will come the first week of January 2026. So you get 25 questions every quarter to take, and you get 5 minutes to answer each question, which is different from the pilot. There is a published list on the NCCPA's website for the dates of when each quarter opens and closes, so you can mark them on your calendar and be, aware and ready to go. And then between each quarter of questions, there's like a 2 to 3 week break before the next quarter begins. So each quarter, like Katie said, you'll get another email from NCCPA saying, Chelsea or Katie, your PANRE-LA questions are ready, or Vicky, check your email. And then when you're ready to start your questions, you log into the NCCPA website, just like you are going to log your CME hours. And then you click on the exams tab, and then you hit launch exam, and it makes everybody nervous. And you have to do this whole attestation thing. So what I did to help me remember is that I added 4 calendar reminders to my phone with the dates that each quarter opened and closed. So a reminder will pop up and say, PANRE-LA questions are open, and it's always there. It's always reminding me to go do my questions, and I just ignore it until I'm ready to take them or if I'm busy. But after I take my questions, I, end my reminder, and then it doesn't bother me again until the next quarter opens. So just something that has helped me keep track of the dates better than checking emails. Sorry, NCCPA.
And if you follow Hippo Education or you want to follow us on Instagram, on social media, we always put like a story up saying like, hey, PAs, the quarter's opening today. And then we put a story up like the day before the quarter closes, like, hey, remember the quarter closes tomorrow. So we also will help you keep track of that. So let's talk a little bit about mechanics of when we're taking the test. So like, what do we use? How's the best thing? What have we done for screens? What have we done for references? And so when I did my setup, I have 2 screens in my office, and on one screen I had the exam open, and on the other screen I had the tabs of all my references open. So I had a tab to a reference guide. I had up to date open, and I also had an extra tab in case I had to Google something that I couldn't figure out. Chelsea, do you use 2 screens when you do yours?
So I actually use 2 laptops, one for the test on the NCCP website, and then the other computer is for just my resources. For some reason, I get nervous that I'm actually going to like close out of the test window or something. So I just use 2 separate windows and just, this is my test and this is my references. I weirdly like to see the time counting down on the test one, so I know how much time I have left instead of like forgetting to navigate back to the testing tab. So that's just worked for me the best. I also have a printed version of the NCCPA blueprint out and a printed version of the normal lab values. You can pull these up electronically, but for me, I just like the hard printouts.
Yeah. I think there's a lot of anxiety and worry about like clicking out of it during the exam, the internet going down, the power going out. That has all happened to me in my 8 quarters. All 3 of those things. I clicked out by accident. My internet went down and the power went out, and it just stops where you are. And we're going to talk about the fact that the first thing you always do when you look at the question is like as quickly as you can pick an answer, even if you spend 3 more minutes thinking about it, so you have an answer chosen. But then it just stopped wherever I was, like question 12 when the internet died, and then when I got back in, it was just on question 13. I mean, my heart was beating and I was so nervous, like something had terribly gone wrong. But it actually is not that big of a deal if you sign out by accident or the power drops or the internet drops. And once you click start the exam, a screen will pop up. And this is a great thing about the PANRE-LA, which is different obviously than the PANRE. It will tell you what the organ system is of the question. It doesn't say like this is about atrial fibrillation. It says this is a cardiovascular question. And then it will tell you if there's an image or a table with that question. So in case you're taking it on your phone, I can't actually imagine taking it on my phone because I get anxious enough with my 2 big screens. But if you're taking it on your phone and you think like, oh, I don't want to have to like try to zoom in or zoom out of an x-ray or a table on my phone or a chart, I'll store that question for later. You know that there is an image coming. So you get the organ system, and then you get told if there's any tables or images, and then you click the like start begin question button. Once you open that question, you have to answer it. There's no more storing of it. There's no more skipping over it. 5-minute clock starts and it counts down to 0. So it starts at 5 and counts down. Some of my PA friends set like a 4-minute alarm so they don't run out of time. It's really big and right there on the screen. So if you do have 2 screens, it's hard not to see it. And I've only had a few times that I've gone under a minute and then it kind of gets red. And of course, in my head, it like counts down faster as it gets going, but the time is not going faster. It's the same time. I've only gotten down like under 30 seconds, like one time. My palms were a little sweaty, but usually I 2 to 3 minutes and then I'd get the answer and I go to the next one. When the new quarter opens, Chelsea, have you taken the test like all at once? Do you do a few here and there? Let's talk some about the way this is flexible for us in our schedules.
Sure. So for me, I have two young kids at home, so I have to like break it up over a couple days just because time is so precious. But I usually sit down after the kids go to bed and like my husband's home to cover down on them. So like within the first 2 to 3 weeks of the quarter being open, I'll like dedicate a couple nights to it. And usually 2 or 3 nights is when I'll do them. Once I'm kind of in that mindset of test taking, I want to knock them all out. I don't want to have it like lingering over my head for a couple more weeks. And honestly, Katie, I know I've told you this, but I store all of the cardiovascular questions and I save them for the end because cardiology is my nemesis. Ugh, it's awful for me. And they freak me out. So for some reason, I feel better saving them to the end after my brain has been in test taking mode again. So that's what I do, and it's worked so far.
When I was taking mine, will come as absolutely 0% surprise to anyone that knows me in real life. I took all my questions the day they opened, like the morning they opened. Like I was done by 10 a.m. the first day of every quarter because I just like to take mine all and get done. I would say like, oh, I'm just gonna take 10, but I'm like, oh, I'll just answer a few more, and then 15. And by the time you're at 15, you might as well just keep going 25. And then it was like 10:05 on the first day of the quarter, and I was all done. So I always took mine all at the same time, but don't have little ones around, have a quiet house during the day. So the most important thing is to find a place that's quiet and a place where you're not going to be interrupted with people coming in and out and bothering you, because that would actually be detrimental right when that timer's going off if someone's bothering you during a question.
Yeah, super stressful. So the flexibility of this test is amazing. You can take one question a night, you can take 5 a week, you could do all 25 like Katie does. It's honestly whatever works for you. So the flexibility, it's great. As long as you get the questions done by the end of the quarter ends, it really doesn't matter how you got there.
Yeah. And we always say that like it doesn't actually matter what you get in the test, it's just that you pass to keep the C after your name. I know that scoring brings a lot of anxiety for folks. Even before you start taking it, I was anxious about how it was going to be scored before I started. And here's the bottom line about scoring: no one knows how it's scored. That's it. It's confusing. NCCPA has a video on their website explaining the scoring, which I've watched, and I'm still like, I thought there was no math involved. Like, that just still doesn't make any sense to me. They employ these really smart statisticians and they use a scale scoring. So you can get them all right and you still won't get a perfect score because the items are weighed difficulty, different ways of the items. One of our Hippo PAs in the very first quarter it opened got a 25 out of 25. Spoiler alert, wasn't me, but they did. And then their score was nowhere near 1500, which is the perfect score. So I was like, wait, you got them all right, but you didn't get a perfect score. It's because it's confusing and they're the way that the items are weighted. So, and then there was a quarter when I was taking it that I got more wrong in that quarter than ever before. And then my score went up and I was like, what is going on? Doesn't matter. What matters is at the end I passed. The scores are scaled between 1000 and 1500. Okay, those are just numbers they picked. 1150 is the passing standard that the NCCPA has published. So you have to get above 1150. And again, that is not like a certain percentage of, no one knows how much that is, the percentage of the total, because it's not how it really works. When you log into the site, after you start, you'll see 3 bars in the scoring section. This is the stuff you have to worry about. Your interim score bar is purple. The passing standard bar is green. It's set there at 1150. And then there's the average score bar for like your cohort or whatever, which is gray. You have to keep your purple score bar longer than the average, than the passing score bar of the 1150, the green guy. As long as your purple one is longer than the green one, you're totally fine. You're going to pass. You can spend time worrying about the scoring and trying to figure out and play the game of how they do it. But I think it's futile because no one really quite gets it. So just make sure that your purple bar stays longer than your green bar and don't spend too much time figuring out why your score went up or down so much, because I think it'll drive you bonkers. And when you are in taking the exam, if you've started already or you're going to start in 2026, when you get your score report, you also see all the questions listed out that you can go back and review. So you can review them from quarter to quarter. Some questions will say replaced or removed. We talk about this in one of our past PANRE-LA webinars that you can find on the Hippo Education YouTube channel so you can check those out. It gets a little complicated, and I don't want to like muddle everybody and confuse stuff for if you haven't actually started the exam, because once you see it, it makes more sense. But if people do have questions about it at the end of the Q&A, I can explain a little bit about the replace and the remove questions. So just pop that question in the chat. Chelsea, I want to talk about storing. I never stored a question, obviously, because I took 25 in a row at 8 o'clock in the morning, the first day of the week, first day of the quarter. But you say you store your cardiovascular questions. Can you explain how that happened? Because I never did it, and what it looks like when you do it.
For sure. So when you get the screen telling you what the question's about, like which system, cardiovascular, endocrine, whatever, you can either click start question, store question, or exit exam. And so if you were to hit store question, you get a pop-up window that makes you verify that you actually want to store it. And so if you hit yes or store question, whatever the words are, then it just goes to the next available question. And so then it just moves them later in your 25 question exam. So you answer the next one. So like ultimately, the cardiovascular ones pop up. I say, oh, no, thank you, store, move on. And so this last quarter, there were 3 cardiovascular questions. And so I stored all of them. So they ultimately became number 23, 24, and 25. So it just moves them to the end of the quarter's questions. You can't go back in and like, oh, now I feel like I can do it midway through. I'm ready for cardiovascular. You just ultimately are pushing them off to the very end. You can also store only 5 at a time. And I've never stored that many, but I read that if you needed to store more than 5, it makes you then answer the first one of the stored ones. And then you can store that 6th one, essentially.
Awesome. And obviously we said that we both work for Hippo Education. Neither of us work for NCCPA, but they have a million little like FAQ videos explaining all these things. So there is a video about storing, but it's then talking about how to do it. So if you have other questions about that, they have a lot of videos about the particular pieces of this exam, but I did not know they went all the way till the end. That's interesting. But yes, so you can't decide to take your stored questions in the middle. You just have to finish them. But you have to take those, whatever 25 NCCPA says, like these are Chelsea's 25 for quarter 3. She has to take all those 25. You can't store from quarter to quarter. They have to be done in that same quarter. So let's talk a little bit about the references that we use. That's the other beautiful thing about this exam. So there's some downsides. It takes 2 years. It got long for me. By the last couple of quarters, I was like, okay, here we go again. Or it could take even 3 years. But the beauty of it, in my opinion, is the flexibility of being able to take a couple questions at a time, or 25 the first day, and then to be able to use references. Because in reality, I think this is one of the reasons why the PA profession and NCCP has gone this way, and a lot of other medical certifying exams have gone this way, internal medicine, pediatrics. There's very little things in medicine that we have to actually like have memorized in our head that we can't look up. A couple things in the emergency room that you have to kind of know off the top of your head right at that moment. But like basically everything else, I feel like in medicine, you have time to look up, right? So I think the ability to use resources and references well is helpful. So that's the nice thing about this exam, is that's open book and we can use whatever we'd like. Besides, you can't use other people. So when I took mine, I used the PANRE-LA reference guide that we're going to show you in just a few minutes. I always had the up-to-date tab open as well, and I had Google when I got desperate. Up-to-date is helpful. Up-to-date has everything in it. Obviously, it's this name, it's up-to-date. But I found that in the time allotted, it was hard to find the right answer, because we all know when we've used it, there's like the pathophys and epidemiology of gout article, and then there's the like presentation and signs and symptoms of gout article, and then the treatment and management of gout article. And it was hard for me, if I had a question on gout, say, to figure out which article I had to go to quickly. So up-to-date I used when I got in a total pickle and a real big bind, but it was always harder to navigate through. And so I thought but I had it open in case I needed it. And then I had Google open in case I needed to ask Google a question. In a minute, Chelsea's going to share a screen and talk about the reference guide, which we've mentioned a couple of times. So this is an online searchable guide that has over 700 pages of content, has images, tables, EKGs, and x-rays to help you during the exam. So when NCCPA came out with this new testing option, they did the pilot, and then there was a couple years of silence, and then they launched that this is a new option for PAs to take. Chelsea and I spent a long time thinking about what's the best way to make something that's helpful, how to make a resource that's up to date, that we can update as we go and as things change, and we can fix typos, and that people can search through, and we can do it quickly within 5 minutes. And so that's why we wrote the reference guide. It's available in 1, 2, and 3 year subscriptions. Most folks get it for 2 years because that's at least the minimum of what you're going to take for your exam. It comes with 18.75 hours of Category 1 CME, and you get that every year. So if you do 2 years of the PANRE-LA reference guide, you'll get those credits for 2 years. And we'll put a link in the chat if you're interested in checking it out further. So
now I'm going to show you around our reference guide. So this is what our reference guide looks like on the homepage. We have a revised date here. We constantly keep our information up to date every quarter, if not more often, we update it. So firstly, I'm going to show you kind of the main navigational ways how to get around our guide. So there is a table of contents on page 2 where it has all the systems, all the page numbers. You don't need to know that, but everything is clickable. So all of these have embedded clickable links. The other option is this left-hand navigational bar with all the systems. So every time you see a caret, you'll click on it and it will open everything up and expand it more. So however you like, you can either navigate on the left, you can click on this top one and get to the topic list here and read all the options. So those are how to navigate around it. How I use the guide when I take my test. So the screen pops up and says, it's a cardiovascular question. And when I finally have to be forced to take them, I open up the cardiovascular system and I'll kind of briefly read through all of the topics just to kind of get my mind back in what the questions could possibly ask. I look and see what bonus content we offer for that system, and then I start my question. So I read the question, I think, oh, that sounds like torsades. Okay, let's go look at it, read through, look at the EKG, look at the symptoms, whatever it is, and it can help you confirm your answer as one of your references. Another option is we have this search function. So say the vignette gives you a certain buzzword or a clue, you can type it into the search bar. So for example, if the question is asking you about gingival hyperplasia and it wants to know like what medication this patient is taking that causes this, you type it into the search bar and hit enter, and it pulls up all the times that it matches within our guide. So we have 4 instances where we talk about gingival hyperplasia. So it's a side effect of a calcium channel blocker. You can tab through all of the options. So phenytoin gives a side effect of gingival hyperplasia. You can see quickly how to get around the guide that way. I would say the biggest trick to the search function is be short, be simple. Don't type in what you would into Google, like not phrases. Important to use keywords mostly because it's the exact text match that we have in here. We have based everything based on the NCCP's blueprint. So if they've misspelled it, we've misspelled it too to match their blueprint. So if you're not sure about spelling, I would just cut it shorter. So if you're like lactate dehydrogenase, I don't know how to spell that. Just do the first couple letters, hit enter, and it will get you there. So when in doubt, do shorter, not longer. And then another thing, if you are looking for something like Down syndrome, leave it without the apostrophe S, because if we don't have apostrophe S, it's not going to match. So with the apostrophe S, there's 0 matches. Without it, it shows 5 matches. So just that's the importance of the extra 4 months. You can kind of play around and learn about the search function. And the biggest thing is make sure you hit enter. If you don't hit enter, it's not going to go anywhere. So you have to enter and it will start your search. So within the majority of our organ systems, we have added some bonus content. So the biggest ones to know about are the pharmacology tables. So down here, we have bonus content, pharmacology essential. So these tables include all the different drug classes that we are including in our table. And it talks about drug names and within the drug classes, mechanism of action, some indication, side effects, yada, yada, yada. But this is where like the bulk of the pharmacology stuff is going to be. In the main like content part of our reference guide, we don't go into a lot of specifics about medications. I'll show you an example. So in the heart failure section, we just talk about down in the treatment section, we just talk about nitrates, diuretics, the renin-angiotensin inhibitors, beta blockers. So if you have more questions, you can navigate to the specific pharmacology table and you'll be able to find a lot more information. I really want to draw attention to our infectious disease pharmacology table. This is where we have all of our antibiotics, our antivirals, our antifungals, and we know that these can show up in any of the organ systems. So just remember to look here in the infectious disease farm table for any of these. So we have penicillins and, all sorts of stuff, cephalosporins that can help you with your questions. And throughout the rest of our guide, we've added bonus content in several of the other organ systems that we felt that was both important and helpful, but it didn't necessarily fit anywhere specific on the blueprint. So for example, in the pulmonary section, we have added the pulmonary function testing information along with pharmacology. So if you get a question about that, hopefully that can help you. In the renal system, we added an acid-base primer and a review, which might be a good thing to bulk up on before one of your quarters if that's like a weak point for you. In the psych section, we recently added, along with our bonus content of the mental status exam, we added childhood developmental milestone table to help you out. And then in like the neuro section, we have our bonus content is cranial nerve review and visual field loss lesions, along with our pharmacology essentials. So just some things, if you don't know these exist, they won't be that helpful for you. So that's why we want you to get in and look around. Also, we have a Zoom function. So for example, if we had, throughout our guide, we have images and EKGs. If you're trying to look at this and you can't see it, you can use our zoom function up at the top to zoom in, zoom out, whatever. You can also right click on this and open it in a new tab to see it bigger. And then finally, we have this emergent topics section, which is on the PANRE-LA. It's on the blueprint, but they don't go into specifics about what they're going to ask. So we've added some content here that we think will be asked: medical ethics, end of life. And so we've done our best to add content there. Katie, is there anything else that you think we should show them about the guide?
No, I think, Chelsea, that was really great. I think the biggest thing about the bonus content is that they're not, these aren't like specific things on the blueprint. Like they don't say childhood milestones on the blueprint, but if they give you a question about a kid who's crawling and then you think that they're this age and maybe they're not supposed to be crawling, or they're supposed to be walking and not crawling, it's good to have some of that. And they're, again, just things that I'm like, there's no way you can take an exam to recertify as a PA and like not get a question on the cranial nerves, even though like cranial nerves is not listed as on the blueprint. So we hope that that's really helpful. And if you think of something that we've missed and something else would be really great bonus content while you're taking the exam, please let us know. And so the last thing I'll say about this is how to give us feedback. So you can always write us an email. So if you write to pa@hippoeducation.com, Chelsea, it comes to my email. Chelsea and I answer those emails. But you can click on this little blue support or little blue feedback icon on the corner, and you can give us feedback. So that is where right during the exam using the guide, hopefully after your 5 minutes are over, between questions, you can use it and say like, hey, I think this should be a down arrow, or hey, I think that's a great, I mean, if we have a typo, we have a greater than sign, not a less than sign, or you think we should add something, or you find a mistake or something in it, please just reach out and let us know. This feedback comes automatically to Chelsea and I. It comes, to our computer, comes to my phone. So, it'd be like 9:30 at night, we're watching TV, and like my phone will ding, and then I'll like look and someone's like, oh, we have an arrow the wrong way, when I'm like not supposed to be working, but I'm working anyway. And so we really want to make this the most helpful. We made it for you. We made it for ourselves. We made it for all the PAs to be helpful to get through this hurdle of having to recertify. And so we want it to be what everyone needs. So please let us know if you have any feedback.
Definitely. The last thing I'll say, not every system has a pharmacology table. So that is, something that we have, like dermatology, we haven't included information about those, for the pharmacology table, but that is the importance of getting in, looking around before your test starts. I think it's important before you start, click start exam, get in here and look around, spend 15, 20 minutes getting used to it, because if you've never used this and you want to use this as a reference, it's not going to be as helpful as if you've had practice and just experience looking around to seeing what we have, So that's the last thing I'll say. Again, reach out, like Katie said, if there's anything you think would be helpful, we can always add it in. So let me
Yeah, and
stop.
once that timer starts, your anxiety builds. So even if you're like, I'm really good at navigating through, and I'll be in it when I was taking it, and I'd forget to hit enter, and I was like, come on, like I know it's in there, like I put this in there, like why can't I find it? And I'm like, okay, take a deep breath, hit enter, like Chelsea told me to do. So even when the minute that timer starts going off, it's like everything is spinning so much faster than it was before. So getting used to it is really helpful.
Totally. So, all right, Katie, let's get into the nitty-gritty about how to ace this exam, how to read a vignette, how to gather some information, hints and tips within it. So for many of us, we haven't taken a test like this in at least 6 years or so, if not 10 years. So I know we're rusty and we can have some anxiety about it. So when I take my multiple choice exams, this is my approach. And Katie's is similar to, you might have a totally different approach. You might not know what your approach is, but this is how I do it. So the question pops up. I just go immediately to the last question. I read the question, what is the next best, whatever. So I read the question and then I go look at the options, the 5 options that they give you. And then that kind of helps me get my brain into the right frame of thought. Like I might not even know what it's about, but I'm like, okay, we're thinking diagnostics, we're thinking treatment. And it helps kind of narrow my thinking down a little bit. Then I'll go read the entire vignette. And sometimes I immediately know what the answer is, or I think I know what it is. So biggest thing, read the question, select an answer. We've said it before, select an answer before you navigate away from that screen and go searching, or to verify your answer. We cannot say this enough. Always, always, always select an answer before you leave that screen. Because like Katie said, you don't know if you're not going to make it back to the screen in time and the 5-minute timer runs out. Your Wi-Fi goes down, the website goes down, some crazy thing happens, it shuts everything down, you panic. Oh my gosh, if you've selected an answer, the computer should use your selected answer as your submitted answer, so at least you have a chance of getting it right. If you have nothing selected and it closes out, it sees it as you didn't answer it, and so you have a 0% chance of getting it right. One final thought about this is just go with your gut and don't second guess yourself. I find that the ones that I've gotten wrong, it's because I've changed my answer from my first instinct. So you know more than you think you know, even if you're in a specialty. But those are just my tips for you.
Yeah, reading the last sentence, the actual question of the vignette is really helpful, because sometimes the way they're written, they'll say, gout is suspected. What is the next best test? And they basically tell you the diagnosis that they're asking you, because sometimes they'll say it right in that sentence. So in that moment, I would still read the whole question, even though they're telling you that this person has gout. And then they're asking you what the confirmatory test is or what the lab will show or something. So sometimes they say that in there, and we can spend an hour talking about whether that's a well-written or poorly written test question, but sometimes that answer is there. The actual diagnosis is in that last sentence, but it is really helpful to have an idea of what you're looking for before you go in. And I do the same thing Chelsea did. I think I probably did it first because A, I'm older, and B, I taught Chelsea all she knows, so I bet I taught her how to do that. But I've taken the PANT and the PANRE 3 times now. My beautiful silver's hairs will show you how old I am with that. So I've answered a lot of questions for NCCPA, and I've also written a lot of practice questions for Hippo. And so I feel like I'm really good at looking at multiple choice questions and looking for clues. Part of standardized testing, which we all know, is playing a game. It was a game of didactic. The PANT was kind of a game. The PANRE every 10 years is also a game and a hurdle we have to get over. So knowing how to play the game and knowing how to answer the test question is really helpful. And being a savvy test taker, sometimes you can get the information you need just by looking for clues, even if you don't actually know a lot about the topic they're talking about. And remember, this is book knowledge, not clinical knowledge. So that can be really frustrating for some folks, because in the clinic you would do X, Y, and Z, but on the book you do A. And so, or you do A, B, and C all at the same time, but the test is making you pick which one you do first, A, B, or C. And in my head, I'm like, we do them all at the same time. Like literally 3 of us do them all at the same time. And so thinking about book knowledge versus clinical knowledge, you really have to take that your clinical hat off and go right to what the book says. And that can get frustrating for folks if you know, like, that's not the right answer. So it could be the wrong answer, and then that question might get removed, or they could be looking for the book answer and then you have your clinical hat on. So don't let that be frustrating to you. Also, if it's not in the question and they don't say it, don't assume it. We assume lots of things about people. We assume things about people when they say what their age is, or what their occupation is, or lots of different things you might assume. If it is not spelled out in the question, you cannot assume that that is true for that patient in that vignette. But here's some specific, some tips and tricks that we have gleaned over the years to help you clue into kind of the best possible answer. And again, we don't work for NCCPA. We don't write their questions. We just write a lot of questions, but just not for them. And so we know these tricks really well. The first thing to remember, this is the biggest key that they give us, is the organ system. They tell you this is a renal question. There are times where I have had a hard time getting the right answer on the PANRE-LA, but remembering the organ system helps me. I'll pick the most renal of renal answers, and that may be the right one. Sometimes there are a bunch of different, like, I can tell the answers are from different organ systems. I'm like, wait, this is the hematology question. It has to be a hematology answer. Now, again, we're going to talk about absolutes. This is never 100% true or 100% false, but the organ system will give you a big clue. If they're asking you a renal question, it'll be a topic on the renal system that you can see in our guide and on the blueprint, and it should be a renal related answer. And so using the organ system really helps. And now, here we go back to high school English. Look for grammatical clues. If the question is asking you for something plural, the answer is going to be plural. It won't be singular. They have to match. Verbs and nouns have to match. It's like the truism of like how to use the English language. And if they're asking about a medication, the correct answer will be a medication. It won't be a lab or intervention. So read carefully and then make sure you look at those clues, especially the grammar clues. If they're asking for plural, then the singular answers are going to be incorrect. And then same with tense and verbs and that type of thing. There's another strategy. I don't know if it has a name, but I like to call it long correct answer. So this is a bit of Sesame Street. One of these things is not like the other. The longest answer is usually correct. So if you see 3 short answers and one answer is particularly long, that is most likely the correct answer. And that goes into what's also called the convergence strategy of test taking. So if there are like 4 options on the exam and one option is this person's sick, blah, 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 admit to the hospital, admit to inpatient service or whatever. And then there's another option, start IV antibiotics. And then there's a third option, admit and start IV antibiotics. That's the right option. A, it's longest, and B, it's the convergence of 2 other options. So that strategy can also help you when you're taking the test to see if you can glean out a correct answer, some clues from that. Look for word repeats. Sometimes a question will have some word repeats in it, like a nosebleed, a posterior, you see blood in the posterior pharynx. They have continued bleeding, in the posterior narrow. Like they may say posterior a few times, and then they ask you like the next step, and it might be, oh, posterior packing of the nose. So if there's some word repeats, that also may clue you in on the correct answer. Another one is paired options. So if 2 options are paired or opposites and none of the other options are pairs, the correct answer is most likely one of the pairs. So if there's 5 answers on the question, on the test, there's A, B, C, D, E. One's a pair, second one's a pair. Hello, Spock from Star Trek. The one that's not a pair is probably the correct answer, okay? If you get 5 question choices, these guys are a pair and 3 of them are not pairs, one of the pair is most likely correct. So looking for paired options, and by pairs I mean lateral, medial, posterior, anterior, things that are paired together in the body, medial cruciate ligament, lateral cruciate ligament, and so looking for the absence of another pair, or the fact that 4 of the 5 are in their own pairs, then it'd be the fifth one would most likely be the correct answer. Now, the last thing I'll say is, this is a shout out to my dad, who's most likely not watching, but hey there, Pops. My dad never uses absolute terms. He never says never. He never says always. He never says none. He never says every. He always thinks there's some gray everywhere, which he's 81 years old. He's most likely true about that after all the years he's lived. But if you do see an answer with an absolute in there, that is most likely, I'll never say always, that is most likely the incorrect answer, because there's always some room for error and wiggle in medicine. There's never anything that's like always this or never this. Somebody can argue that, and NCCPA wants to give us questions that are non-arguable. They don't want people to write in mad. And so using an absolute term is usually a trigger and a clue that that is not the correct answer.
Yes. And I will add again that it's really important to read the question closely, as I've said many times before. So a lot of the exam questions will ask about the initial intervention or the confirmatory test or the definitive diagnosis. They have, these like little phrases they use. So for example, if they describe a patient who comes in with new onset shortness of breath and they had a recent trip to Thailand on an airplane, and you're like, oh, this person has a PE, the question is asking you about a confirmatory diagnostic test. Sure, you can do a chest x-ray and you can get a D-dimer, but for a PE, the confirmatory test is a CTA. So remember to pay attention to like what they are asking you. You might have to look and read the question, the last question in the vignette 2 or 3 times through, but just know what question you're answering before you hit submit to make sure that you're not rushing. If you have no clue whatsoever what the disease process is, like the person's a shipbuilder or they work in a quarry or something, they've given you a clue to what the question is. You can all else throw it into Google, like what causes a cough in someone that works in a shipyard. It can maybe get you back on track. So, and you can also browse the topics on the blueprint. We have them listed in our table of contents exactly like the blueprint. You can look at the options and it might get you back on track.
Yeah, I think that using the Google is the last resort to just ask it something like why do pregnant ladies get joint pain, and just see if it like pops up something that reminds you of where you're going, and then getting back into the guide or using a reference that way. So the last thing I'll say about smart test taking strategy, again, I just talk about my absolutes. This is not absolute, but most likely the easiest and most basic answer is correct. So what I mean by that is if someone has carpal tunnel and they've done nothing before for it, new diagnosis, the answer is going to be lifestyle modification like a night brace, a wrist splint versus an injection. Or it's going to be like PT over a surgical consult. So of course, the 2 most universally always correct answers in everything in medicine / in life are secure the airway and quit smoking. Now, in saying that, don't send us hate mail if that's not correct, but you can, pa@hippoeducation.com. We will read it and we'll write back to you. But you have to obviously look at the scenario. If it's an ICU patient intubated with a COPD exacerbation, yes, that person most likely needs to quit smoking, but not like right now. Like that's not the intervention for that particular patient at this moment in time, intubated in the ICU. But securing an airway and quitting smoking is as best as I can say, as an absolute always the correct answer. They are almost always the correct answer. And make sure that you think about this and use the clues. And if you get down to 2 answers and you don't know and you're like, I'm stuck on 2, go, if you have time, go back and read the question over. You may have missed something. Is this person pregnant? Is their vital, did you miss an abnormal vital? Did they travel somewhere you just kind of skipped over and glazed over that fact? So if you get down to 2, go back and see if you've missed something. For me, it's always vitals. I assume everyone's vitals are stable. I don't know why. I never look at them. I look at temperature, but I kind of forget all the other ones. And so sometimes I go back, I'm like, oh, that's a real low blood pressure. That's smart. I probably should pick that up the first time around. So if you get down to 2, go back and see if you miss a clue. And if you get down to 2 and you really think they're both right, at that point you just pick one and just think like, okay, hopefully this one will get thrown out because it's a bad question. We have about 15 minutes left. Chelsea, anything to say about strategies of test taking or those before we go to some questions?
Not really. Just remember, if it's your first time, get onto the NCCPA website, listen to the PANRE-LA tutorial before you take your first quarter, get around the reference guide, kind of get used to it, know where the normal lab value table is. There is a normal lab value table. You don't need to know these things. So just kind of be familiar with the format of everything can help you and ease some anxiety before your questions start. That's it.
Awesome. Okay, let's answer some questions. What happens if you miss a quarter? Okay, if you miss a quarter, nothing happens. You just have to take another quarter. So I took mine eight of eight. But if I had missed quarter five, I just would have taken quarter nine, and then that would have been my eighth quarter. When you get done with eight and you pass eight, you will know you passed because your score comes up and you pass. And then about 48 hours later, you get an email, which you should read, by the way. Speaking to Vicky out there, and from the NCCPA, it says, Katie, you passed. You're done. Congratulations. See you in 10 years, except for in 2 years because you owe us some more money. But they're done. And so then you kind of get locked out of the system. You don't get a ninth quarter. You can't just keep taking questions because you think they're fun or you want to learn more. You're just done out of the system. So the minute you pass your eighth quarter, you kind of get locked out. So if you miss one, you just take another one. Now you only have 4 wiggle quarters, so you can't miss 5. But if you miss one, it just nothing happens. It just comes up and the next one happens.
And don't, Katie, the rule is, so you have 3 years to take it. You have to pass 8 of the 12. So 8 quarters is 2 years out of the 3. You have to take 1 quarter in the first year. Like, isn't that one of the rules? Like, you have to do at least one. So you could skip 3 of year 1, and then at least you have the first one done. But I think that's one of the rules.
Yeah. Someone asked about where the pharmacology information is located. It's in the bonus section at the end of every section, at the end of the section. So there's pharmacology content in cardiovascular, in endocrine, in GI, in psych, in neuro, in palm, in
Hematology.
heme. What am I missing?
Psych? Did you say psych?
I said psych. The only it's and to say endocrine, there's no pharm content specific to EENT because most of that's infectious and that's an ID. I missed ID. There's no pharm content in reproductive. We have lots of information about like birth control and that kind of stuff in reproductive, but any like infection stuff will be in ID. But all the other ones should have that, and those tables are at the bottom of the whole blueprint list goes from A to Z, and the very bottom we have that bonus content. You go, Chelsea.
Someone said, this is not a question, but a comment. Heads up, the PANRE-LA does not allow copying and pasting a word or a phrase from the test question anywhere else. So you have to type the word or phrase into the Hippo search bar. 100%. They won't allow copying and pasting at all. So.
And you sign a big thing saying you're not going to talk about your questions and that you're not going to, the thing that you sign for test security. But yes, no copying and pasting of the screen. But you can go to the next screen and type, type gingival hyperplasia or type what makes a pregnant lady's ankles hurt or whatever, and the answer is they're pregnant with a baby, that's why their ankles hurt. But that's how you would do it. No copying and pasting. Someone asked, using the Hippo education subscription, what percentage should I rely on it versus other sites like Google? So I'm done now. I probably relied on it. I use it for every question. So even like I get anxious, and even if I knew the answer, like that's gout, that's pseudo gout, that's amoxicillin, that's cranial nerve 11, which I don't even know what that one is. I do, but I'm just kidding. But if I knew it for sure, I still went and double checked myself, and I used the guide for that. There were probably, I would say, 1 to 2 questions a quarter. I was like, oh geez, like didn't even know kind of where to start. Even when I saw the topic list, like of hematology or of renal, I couldn't figure out where to start. And I'd go to Google and type in a question like, what is the 3 reasons why this person might have a bloody nose or something? And then trying to pull something out of Google. Then I would use that to go back into the guide. I only used Google if I really could not find anything particular in the guide because I didn't know where to start. But if I knew where to start, the guide really gave me the answer that I needed.
Yeah. Another question is, are you allowed to revise an answer after selecting one? So after you submit it, no, you cannot go back. You submit, that is your final answer. What we mean, like read the vignette, select your answer, then go look at your references to make sure. Once you've clicked the little like circle, it doesn't submit it until either A, the timer runs out, or B, you hit submit. So once you click your little bubble and go search and you're like, oh, actually, I am wrong, you can change it still. But once you hit submit, that's it.
Yeah. Someone asked, who will see my final score? Can my employer request or they just see pass fail? And that, I think an employer can only, okay, I'm guessing here. So someone can correct us in the chat. I think when an employers go to NCCPA and like like clarify or like confirm someone's a certified PA. I think they just get confirmation that you're up to date and have the C behind your name. I don't think that those score bars go anywhere. I don't think employers can see like the score of your pants. I think they can just confirm that you are a certified PA who's up to date on all the things for your certification. But again, I could completely be wrong on that. But all like my score bars are disappeared now because I'm out of the test. So I don't think that anyone else can see those.
Yeah, I don't think so either. Another question is from Reese. What is the best way to prepare or study before? What is the best way to prepare? Study beforehand or learn as I go? So there's no way to study for the PANRE-LA beforehand. I mean, that would be just go take it in the testing center if you're gonna like crash study for 6 months. I didn't prepare at all. I mean, I guess like I did a couple practice questions leading up to it just to get my mind into test taking mode. Hippo has a few other subscriptions for question banks that you can purchase if you want to like practice on questions. You could also log into the NCCPA website and buy what's it called, Katie? Those practice exams.
Practice exams. Mm-hmm.
You could purchase a practice exam and get some questions under your belt, but you can't study. That's kind of the purpose is you can't prepare for all of it. So just jump in, take it, and then you can learn some of your weaknesses. And then the next quarter, read the questions again that you've had, study up on if you got something wrong on gout, study that because you'll for sure see it again if you got it wrong.
Yeah. So the way the longitudinal assessment works, and we do talk about this in some of our other webinars, is that up to 5 questions that you either get wrong or they just choose for you, you will get those topics the next quarter. If you got a question wrong on tennis elbow, lateral epicondylitis, you will get another question on it. Guaranteed, they tell you that. NCCPO tells you that. So study the ones you got wrong because you know it's coming back. And then if you got them all right one quarter, only got 3 wrong, they still repeat 5 topics. That's where those removed, replaced questions come in because they repeat topics for you. So if I was in charge and NCPA is listening, which I know they're not listening and I'm not in charge, I would love them to tell us what our quarters were up to. I would have maybe liked to study a little bit more, but like in terms of this assessment, like your first quarter, Chelsea, is going to cover endocrine, reproductive, and infectious disease. So then you could actually do a little bit of studying. That would be the only way to prepare is that they told you what your questions were going to be about. But you could start studying now and think, I'll be ready to go by January, which is great, but you might not get an endocrine question until like your 3rd quarter, and then you've forgotten it all. So the only way to study is that they ever told us that, which they haven't, and I don't think that they will. But like for example, the pediatric board, they do this like their maintenance certification. They list the topics they're going to be in 2025. You're going to get caught these 45 topics. So you can just study those topics in that year. They obviously have not told us that or gotten that specific for NCCPA yet, which is fine, but that would be the only way that studying really works. Oh, someone said if I sign up now for the PANRE-LA, first quarter begins in January. Yes, correct, not sooner. January 2nd, the quarter that your exam will start. December 18th, your registration window ends, and then it starts. Let's see what happens if you fail? Okay, if you fail the PANRE-LA and in your 12 quarters you don't pass, okay, so bear with me in terms of math here. Year 6 you sign up. Year 7, 8, and 9 you take your PANRE-LA. If at the end of year 9 you have failed your PANRE-LA, you have year 10 to take the PANRE in the testing center before you lose your certification. So there's that buffer year at the end that you can take it again. You can take the PANRE in the testing center in your year 10 if you have failed the PANRE-LA at the end of 12 quarters.
Someone asks, are there printing options for sections of the PANRE-LA reference guide? So no, this is not printable. It's like 700 pages. I don't think you want to hit print. I mean, you can't, but even if you could, I don't think you want to find that out and use up all your paper and your ink. But the purpose of it being electronic is so that we can update things if guidelines change or if we find an error. We would hate to have it out there in the world and we can't take it back and like fix things. So the people that use it have incorrect information. So no, we do not have printing, the ability to print, unfortunately.
Okay, we have a few minutes left. Let's hammer some of these last ones. Does someone ask if HippoEd gets stats on what's looked up in the reference guide to update content for those using it during it? No, we don't get stats. And the reason why is test security. Like I can't find out what's on your test. So I don't want to see that Chelsea's looking up gout, shoulder bursitis, premature rupture of membranes, pulmonary hypertension, MI, whatever, because no one can know what your test questions are. So we don't get any stats that way. We don't know what people look up or any of that content. None of that's reported back to us because we want to keep the NCCP test as secure as possible. Because the problem is, if we as a whole, not Chelsea and I, not Hippo Education, but we PAs as a whole, if we ruin this at-home version by doing sketchy things and making this test insecure, then NCCPA most likely is going to put all of us back in the testing center for 5 hours every 10 years. And so keeping the test with all of its integrity is super important to us, not only as PAs, but working for Hippo. So yeah, no, we don't get any data on that. Someone asked, how do you earn 37.5 CMEs? Are there extra exams to take to get these hours? So you get 18.275 CMEs by just having the guide. So that is an automatic amount that the guide is for. So when you have the guide, you can just claim those CMEs during the year of using your guide. And then you use your guide's year 2, you can claim your CMEs for that as well. There are no other extra exams to take. You just get the hours by using the guide. We have a couple practice exams that Hippo puts out. One's called the General Practice Self-Assessment. If it's coming up to be October, November, December, and you're getting worried and anxious about the exam, you can purchase one of those. They're discounted for AAPA members, and you could do some practice questions, and then you could actually pair the two. You could take a practice question and then pair finding the answer in the guide to get practice going back and forth. But no other exams to take. You just claim the hours when you have the guide.
Someone asked, when you find out which questions you got wrong, do they reveal the correct answers and provide information? Also, is the information about your correct options available over the entire course of the 2 to 3 years? How about when you finish the test? So the second you submit your answer, it tells you correct or incorrect, and it goes the whole explanation. You can read it. So I read them, immediately after I submit it. You can access it in your dashboard throughout the quarter. You can see your past questions and answers over the whole time, unless they remove the question, and then you can't see it anymore for that one specific question. And then after you finish the test, right, Katie, you can't see them anymore. You're out, you're locked
I'm
out.
out. So but when you're in the test, you can go back and see all your quarters. So before I got knocked out, I could see all 8 of my quarters, and it tells you the topic. You can click on it. It shows you the question, what you answered, what the correct answer is, where the references are. All that is there for you to study from, to look at your old questions. But yes, once you're done with the test and they send you that passed email, they kick you out and you can't see them anymore. Let me answer this last one. It then says, are wrong answered questions repeated exactly the same or reworded? No, just the same topic. So if you get something wrong on mumps, you'll get another question on mumps. It'll be about treatment this time, or about vaccine instead of about symptoms. It's the same topic, but a different question. Okay, we're going to wrap up. We're so glad you guys all got to come. Please reach out to us at PA@hippoeducation.com. If you have any questions about the exam, specifics about our guide, we're really here to help, and we're really glad that you could join us. And we're cheering you on as you take your PANRE, because we're taking it too. Well, I'm done, but she's still taking